This video will review the purposes of and how to complete the pre-placement report. The student will complete section 1 and 2 of the report and will send the partially completed report to the placement preceptor at least 1 week prior to the placement for the preceptor to review. In this way, the preceptor can consider the strengths and learning objectives of the student when planning placement activities. The students will complete section 1, where they will highlight 3 or 4 of their strengths that they're bringing to the placement. Learning objectives, item 2, should be grounded in the competencies and based on the student's past performance evaluation findings and in consideration of the placement's unique learning opportunities. Students should clearly identify what actions, opportunities, and activities will enable their learning and highlight the behaviors that will demonstrate they have accomplished the learning objective. For example, if this is a placement with opportunities for counseling, the student should focus their learning and maximizing their placement time using this skill. The learning activities involved in counseling correspond with several ICDEP competencies that the student can identify in the first column. For example, they may identify 3.03, use effective oral communication skills, 3.05, use effective interpersonal skills, 4.05, foster learning in others, and 5.04, provide nutrition education and provide nutrition counseling. To continue with this example, the student may take the following actions to develop their counseling skills. They may review the information provided during the motivational interviewing education session provided prior to the beginning of the placement. During the first 2 days, they may wish to observe their preceptor counsel patients. They may review common patient education tools and resources used in the clinic. By the end of the first week, and with the preceptor and patient's consent, the student may begin practicing gathering patient assessment data. By the end of the placement, the student may wish to demonstrate the ability to accurately gather patient assessment data and to propose nutrition care goals based on this data and the patient wishes. They may provide nutrition education using available education tools to support the nutrition care plan. The preceptor will set aside some time during the first week to discuss the student's learning objectives and the feedback approach for the placement, items 2 and 3 on the report. Students may need to revise their learning objectives based on the actual available learning opportunities in the placement. On the second page, you'll find discussion points. These are an opportunity for the student to highlight their preferred learning style and feedback approach. These discussion points are intended to support the conversation between the student and preceptor when finalizing item 3, outlining the feedback process for the placement. By the end of the first week of placement, the student and preceptor will finalize the pre-placement report. Once completed, the pre-placement report should be signed by the student and the preceptor. By checking the response box at the end of the form, you are both verifying the information is true and correct. The checked response box is accepted as a replacement of a handwritten signature. The signed and completed pre-placement report is emailed to the dietetic education coordinator by the end of the first week of placement. This can be done by either the student or the preceptor. Please ensure to include everyone on the email, that is the student, the preceptors, and the DEC, so that everyone has a copy. The student will upload the completed checklist to their OWL Dropbox.